Coming up on Bridge City News, Sean Connery, the original James Bond, dies at 90. A plan for increased immigration to Canada over the next 3 years. And it was the last farmers market of the season this weekend.
Your nation, your province, your southern Alberta. From the heart of Lethbridge, it's Bridge City News Weekend Edition.
Thank you for joining us. Movie legend Sir Sean Connery, who played the suave, sophisticated British agent James Bond, died today. He was 90 years old. His son, Jason, said his father died peacefully in his sleep overnight in the Bahamas where he lived, having been unwell for some time. Connery is survived by his wife, brother Neil, and sons Jason and Stefan. New federal modeling indicates that at current rates of in-person socializing, Canada could see COVID-19 case counts increase to 8,000 per day come early December. Dr. Teresa Tam says more regions have reported increased rates of infection over the past 2 weeks, with 26 Indigenous communities reporting 2 or more active COVID-19 cases. The forecasts predict that Canada's total COVID-19 count could reach 262,000 cases and 10,400 deaths by November 8th.
Over the past 2 weeks, British Columbia, the Prairie Provinces, and Ontario have all marked their highest daily case count since the beginning of the pandemic. We have seen some clusters of cases within the Atlantic bubble, notably with New Brunswick implementing stronger regional public health measures to limit further spread. And in the territories, while a few travel-related cases have been identified recently, and one cluster is currently under investigation in the Yukon, there has been no widespread community transmission. Worryingly, we are seeing that the percentage of people testing positive is continuing to rise across the country. Currently, the average percent positivity is approaching 4% nationally, and there have been some concerning spikes in test positivity in some provinces recently. While we have consistently observed the highest incidence of COVID-19 among young adults aged 20 to 39 years, we're now seeing a concerning rise in the incidence among individuals 80 years of age and older, which is the age group at highest risk for severe illness and death.
Federal Immigration Minister Marco Mendicino laid out a plan for increased immigration to Canada over the next 3 years to help the economy recover and grow after the pandemic. He says despite challenges, he's optimistic the targets can be met and says they are essential.
We're facing the challenge of our generation, and we will meet the moment. Before the pandemic, our government's goal to drive the economy forward through immigration was ambitious. Now, it's simply vital. Travel restrictions and other constraints have led to a shortfall in admissions this year, which is why our plan increases immigration over the next 3 years. We aim to welcome 401,000 permanent residents in 2021, 411,000 in 2022, and 421,000 in 2023. With nearly 60% of all new admissions in the economic class, our plan will continue to focus on Canada's economic growth. Immigrants create jobs. Immigrants are putting food on the tables of Canadians, they're taking care of our seniors, and they are driving the economy of tomorrow. And at no time in recent history has that been more important than in the context of this pandemic. And so what this plan does is it lays out a future vision for growth, economic recovery through immigration. Throughout the course of this pandemic, we have been able to maintain safe and orderly immigration by introducing additional resources and enforcement protocols at the border. And as a result of that, we've been able to bring in workers, we've been able to bring in students, all the while ensuring that quarantining protocols are being strictly adhered to because the health and safety of Canadians is our top priority.
With the Lethbridge Farmers Market wrapping up today, some vendors are looking back at operations during a market season that was anything but normal.
I've been here at the farmers market for like 4 years in a row now, I believe, and it's been really amazing, and this farmers market really helped us So they all know about our store because of this one. The community here at the farmers market, like everyone knows each other, and it's kind of like sad to see that we can't be able to see each other anymore, all the vendors in here.
The book is about stories of ex-Jehovah's Witnesses who either grew up or were converted, and when they left, how it impacted their life, and then how they were able to overcome things like being shunned from everyone in their family and all of their friends they ever knew. Chapter 6 is about my story of growing up as a Jehovah's Witness in British Columbia, in a very small town. If you don't know anything about Jehovah's Witnesses, you're not going to learn a lot about the religion itself. You're going to learn about the people in it and the struggles that they would go through in it, but also the happy times that they had in it as well.
With 4 days to go until Election Day, Democrat Joe Biden campaigned in Wisconsin late Friday and urged his supporters to deliver a thumping victory on Tuesday.
Folks, there's only 4 days left. Millions of Americans have already voted. They tell me now it's up to about 85 million Americans have already voted. And millions more are going to vote before this election is over. And I believe when you use your power, the power to vote, you can change the course of the country and, quite frankly, right now, the course of the world, because it's leaderless now. Donald Trump waved the white flag, surrendered to the virus. But the American people don't give up. We don't give in. Unlike Donald Trump, we're not going to surrender to this virus. We're simply not going to surrender. Folks, I'm going to protect Social Security, Medicare, and Medicaid. And guess what? He's not going to be able to do it because we're going to win this election.
U.S. President Donald Trump dangled a promise to restore normal life as he looked to campaign past the political damage of the pandemic. He was speaking in Minnesota for his third rally of the day, making his final pitch before Tuesday's election.
There will be no school, no graduations, no weddings, no Thanksgiving, no Christmas, no 4th of July, no Easter, no nothing. There will be no future for America's youth. Under my plan, we will deliver a safe vaccine to the American people in just a matter of weeks, and it will be something that will be very, very special. And we are rounding the turn on the pandemic. With or without vaccine, we have the vaccine, it's going to come, but even without it, we're rounding the turn. Seniors will be first in line to get it, and it will be available free. It wasn't their fault, it wasn't our fault, it was the fault of China. We should have kept it within their limits. Our vaccine will eradicate the virus and the pandemic, and it will end. Quickly restore normal life. That's what we want, is normal life. Take us back 7 months, normal life, record-setting everything.
Recapping one of our top news stories, movie legend Sir Sean Connery, who played the suave, sophisticated British agent James Bond, died today. He was 90 years old. Connery's son Jason said his father died peacefully in his sleep overnight in the Bahamas, where he lived, having been unwell for some time. Connery is survived by his wife, brother Neil, and sons Jason and Stephen. And a look at weekend weather. Clocks fall back tonight, giving us an extra hour of sleep after Halloween ends. Overnight, it should be clear with a southwest wind gusting from 30 to 50 and a low of +3. And for tomorrow, sunshine with more wind and a high of 16. After the break, catch our interview with Lethbridge Police Chief Shaheen Medizadeh, who'll discuss his plan on dealing with the crime and drug issues in our city.
Well, ripping the tents down is really not a police function. It's an element that the city has to make a decision what needs to be done with that. But ripping one tent down may result in 2 more tents going up. The whole concept of that comes when you have a venue that people are promoting safe drug use, in this case, which we haven't seen actually any evidence of anyone going in there. In fact, we were talking, majority of the users in downtown core, when our officer were asking them, would you ever use that tent, they say there's no way they would use it.
The city of Lethbridge has a new police chief. He's a veteran of the RCMP for over 30 years, working from Vancouver to Halifax and internationally too in places like Europe and Mexico. Chief Shaheen Medizadeh, welcome to Bridge City News.
Thank you. Great to be here.
That's great to see you here. Now let's talk about some of the experiences. Europe, Mexico. Did you ever have to work with some of the drug cartels? Work in some of those cases?
Well, we were working projects that would take us obviously to different countries, from being in Europe, Mexico, US, but technically they were all drug organized crime files that we were working on.
Now you're in Lethbridge, the Windy City here, where it appears like we skipped fall altogether. We went from summer right to winter. Are you settling into your new role?
I am. I've found in a short time. This is my 7th week on the job here, so I'm really glad that I really getting to know the team, and we have a wonderful team with the Lethbridge Police Service, and also the community has been great, very welcoming, so it's been great.
So let's talk about some of the differences you've noticed between working for the RCMP for over 30 years and now with the Lethbridge Police Service during your short time here.
Well, as I often say, police work is police work. Doesn't matter what uniform you put on. In RCMP, obviously, we have the jurisdiction, bigger jurisdictions, longer drive times, etc., where we have in Lethbridge a city to look after. But RCMP also, we had contracts in major cities that I've worked in. But again, when you come to it, police work is police work regardless of what uniform you put on.
Now, during your many years with the RCMP, you've worked in different First Nations communities. Now, you're known for building strong ties with various communities. How will that experience really help you as we work towards reconciliation with the Blackfoot Confederacy here in southwestern Alberta?
Well, with any Indigenous community, obviously, the true piece of building relationship is to understand and to respect their culture and customs, and also learn about, doing our best to learn about them, because sometimes ignorance is not a good thing. When we learn about those customs and cultures and people, we understand that it's a great culture and they have a lot to offer to this country. So it's all about understanding, truly understanding them, and making sure that we work with them to create the societies that we have in this country.
How about the opportunity to potentially hire more Indigenous police officers who can maybe connect more with the Indigenous community?
There's always that, we always welcome those opportunities, and I know there are recruiting people they're investing time to make sure not only Indigenous community, but we're also trying to attract other candidates from immigrant population, more women. But again, it's something that we have to make sure the people who truly desire to get into police work are applying for it, and when they do, we are going to do everything we can to make sure we increase that diversity within Lethbridge Police Service.
Now, you've also brought on Holly Fortier, who's providing some Indigenous awareness training. How is that going so far, and why is that so important? Well,
with Holly Fortier, the reason we brought her, obviously, she's a well-known presenter in relation to Indigenous culture and history. And I think it is really important for our staff to understand the true history and what has gone on before. Part of reconciliation is looking at what happened before and how we can actually move forward from that. So Holly brings a really good perspective from all Indigenous community perspective, not necessarily one or two, but she's providing a global perspective on Indigenous communities in Canada, the history from the Indian Act to 60s Scoop, etc., to really help our staff understand what has gone on and why we are trying to really move forward from the past.
The COVID-19 pandemic has been a big issue around the world, including here in southwestern Alberta. But before we get to that, let's talk about the drug crisis, which has not gone anywhere. You know, and many police officers I've spoken to, they say it's not so much the opioids, you know, like fentanyl or carfentanil. Now it's meth. Meth is apparently taking over the streets right now in Lethbridge. How can we keep the drug trade out of our city?
Well, if I had that answer to that question, I'll be making a lot more money. the drug issue has been around for many years, and we see different types of drugs, and depending on the what's out on the street and what is being pushed to people basically to build that dependency and basically marketing of that illegal product. So the meth has always been around, but it just matter of why is it become a big issue in Lethbridge right now? I don't have that answer. But the solution, I believe, is moving forward is obviously police has a role to play as far as enforcement goes, but this goes beyond just enforcement. This goes about bringing other key players and partners into the equation, from addiction to mental health, to really provide the help that the users need. And also, from the police perspective, holding those who are distributing these drugs accountable by doing projects and making sure we do our part in that front. But the drug problem is a very complex issue. Why people choose to do it, I don't know. Again, we can always ask the drug users, but
some people say it's an escapism, dealing with depression or other issues. And I mean, you're addicted. Bottom line, whether it's alcohol or drugs, people get addicted, right?
But I've been around drug world for many, many years. I've seen from the days that we would seize 50 marijuana plants and we thought we had solved the drug problems of the world, to getting into seizing multi-kilos of cocaine or meth and still knowing that there is a lot more out there. So the problem with drugs today is the way they are produced and designed. Their potency is gone way higher. So,
and more lethal as a result.
They are very lethal, and again, when the potency goes so high, when people get addicted or they even try, they're not just trying to say, okay, I tried and I'm not going to try it again. They get immediate dependence on that drug and addiction to it, just because it's just a marketing scam that goes on to produce drugs that are much more potent and addictive. That way, the criminal element can take more advantage of and abuse those users for the profit.
Lethbridge Mayor Chris Spearman has been on our show in the past saying we need a full-time scan unit or the Safer Communities and Neighborhood Unit to permanently shut down the drug houses. How important is that for our city?
It is important. The more drug houses we shut down, the safer the city becomes. These drug houses are not just bringing an element of drug use and trafficking. There's whole kind of other issues around drug use and trafficking, which when you have other criminal acts that are committed for those who are dependent on drugs to support that habit, which brings basically other issues to the community safety and from property crime to other issues.
So like maybe also human trafficking as well, right? Probably see an increase of that too, not just drug trafficking.
That's always on the table as far as because again, when you look at how females are abused within that world, the sex trade and their dependency, absolutely, there's really the criminals are actually playing on using these users to obviously make profits, but also there's other things that are going on that they can make it more profit. Sex trade is being one of them.
Since the province pulled funding towards Arches and the supervised consumption site, we have the mobile unit now set up at the soup kitchen run by the province. But since that was shut down at Arches, have you seen more drugs, less drugs, more users? Are we seeing more needles being spread around the city? What are your police officers telling you?
Well, the mobile unit obviously allows for 2 people at a time to consume their drugs, and then there's a waiting period that they need to go through before the next 2 can go and use that. So it is working, it is being used. Is it enough? No. So my suspicion is actually the drug users are using the drugs away from that site and in other public areas.
And some of those public areas, we've seen the orange tents go up from former employees at Arches with the Lethbridge Overdose Prevention Society, or LOPS. And many people, residents in Lethbridge, are angry at that, saying this is illegal, you shouldn't be doing that. So why aren't you and your police officers ripping those tents down and throwing them aside, saying, guys, you can't be doing this?
Well, ripping the tents down is really not a police function. It's an element that the city has to make a decision what needs to be done with that. But ripping one tent down may result in 2 more tents going up. The whole concept of that comes when you have a venue that people are promoting safe drug use, in this case, which we haven't seen actually any evidence of anyone going in there. In fact, we were talking, majority of the users in downtown core, when our officer were asking them, would you ever use that tent, they say there's no way they would use it, because there is really not proper medical attention or
counseling, right?
Counseling that goes on in there. So our officers have not seen any criminal act for us to act on. So as a result, we are kind of keeping an eye on things and hoping things are going to be peaceful between the tent and the protesters. But the liability that they're taking on as far as providing this presumed safe location for people to use drugs, if they're using it, we haven't seen any evidence of that. And if somebody loses their life, when you look at these sites, safe injection sites, it's not as simple as giving Narcan to the user, and majority of times it does work, but it doesn't work all the time. Right. So it's all about the liability that they're taking on. I hope they're truly, both the organizers and volunteers, are really reflective of that to know what liability they're taking on.
How has the COVID-19 pandemic really impacted the police force here in Lethbridge? Specifically, I'm wondering too, if a police officer pulls somebody over, do they have to wear the mask? You know, if they're arresting somebody, you know, maybe a domestic disturbance, do they have to wear a mask? Like, how has that really impacted how you serve our community?
We are using every safety protocol that's basically mandated and both by the city and the province, as far as keeping our officers and the public safe. The key is to make sure that we abide by those protocol, and yes, masks. We even wear masks in our office when we are interacting with each other, just to make sure we keep each other safe, because we need to have a healthy team to support and serve the public. So yes, we are taking all those measures.
Now, prior to you arriving here, Shaheen, there were some allegations of bullying taking place at the Lethbridge Police Department by the former interim chief and then the former chief before him, who's now living in Ontario. How will you change the culture moving forward and perhaps protect or maybe speak to some of those officers who may have felt bullied?
Well, I'm not going to separate officers who may have felt bullied or whatever. And again, as I mentioned before, what happened in the past really is in the past. I'm not there to dwell on what happened in the past. What I can look at is how I, as a new chief, can conduct myself and help the department hopefully move on from whatever experience they've experienced in the past. I have an open door policy. I'm already engaged with talking one-on-one with employees, not just a few, but every employee. In fact, my schedule is full until probably after the New Year's, giving opportunity for every employee to, again, for me to get to know them on a more personal basis, and then also to show that as a chief, I'm a teammate. I'm one of their teammates, different level of responsibility, but it's all about the team environment, and as teammates, we need to work together to make sure we have a healthy, resilient, and agile team that actually is more happy and comes to work for the most part. I can't fix every issue, but again, if we have a healthy team, we can better serve our true masters, who's the citizen or the citizens of this great city.
We live in some very interesting times right now. There are calls to defund police all across North America. They say we should allocate some of that money towards funding education and social programs. What would happen in our city, let's say, if the police budget was cut by 50%? What would really happen?
Well, the funding topic, really, nobody has really truly sat down to tell me what that means, because the board keeps getting it on and becomes flavor of the day. But really, what does that mean? Right now, from a policing perspective, not only Lethbridge, anywhere, we have people calling the police because one neighbor can't go speak to the other neighbor to turn the volume down. They refer to the police to do that. People call us to deal with their kids at times. So again, for me to have any sensible discussion about defunding, I need to know what does that mean, Because right now we are taking thousands of calls. Are all of them police related? Not really, but we still expected to respond to them and do our job to serve the community. So the funding model, if again 50% cut, as you say, is the city willing to have a maybe 6 to 7 hour police service and that's it? Rest of the time.
A 9 to 5 police gig, right? And then,
Exactly.
no crime after 5 o'clock at night.
So that's the thing. So it's all about what does the funding mean? What do they mean by it? And really, is that a realistic? We don't live in a perfect world. And in case of when homicides happens, when crimes that are happening that are really truly impacting the community, who's going to look after that? Nobody has actually given me an idea about how that works.
Lethbridge Police Chief Shaheen Medizadeh, thanks for your time today.
Thank you very much for your time.
We are still being affected by the COVID-19 pandemic. Researchers are continuing their search for a vaccine. In the meantime, there are treatments being used on those infected and continued hopes that our own immune systems can do the job to fight off the novel coronavirus. Dr. Francisco Delgado is a chair for a very special stewardship committee at one of the major hospitals in Indianapolis, Indiana, and that's where he teaches about internal medicine. Dr. Delgado, thanks a lot for your time today.
Thank you for the invitation to be with you.
Not a problem. Now, when you first heard of COVID-19, what were your thoughts and what did you think about the symptoms and the virus as a whole?
We had a little bit of background from the first coronavirus that was called SARS, SARS #1, which I think you were closer to because you had some cases up all the way to Toronto. So we knew a little bit what to expect. We just didn't have a lot of information in the very beginning to know how much of a problem this was going to be, and it turns out it was a lot more problematic than we were expecting. Yes.
Has the virus mutated in any way as it's gone from person to person?
The viruses change their genetic material. So when you talk about mutations, there are always mutations within viruses. Those mutations are usually very small. Really, at this point, not clinically significant, meaning that those mutations do not, we cannot talk about different viruses per se. There's just small changes in the genetic material of the virus. So in a way, yes, it is mutating, but the mutations are not significant at this point.
Is there one vaccine that can really wipe out the entire virus?
We hope so, but it's not here yet.
Now, what's currently happening in the pursuit to create a vaccine for COVID-19?
Well, what's happening? There's a lot of vaccines that are being evaluated. Last I heard, there's about 44 or something different candidates. Only a few of them have reached what we call clinical studies. That means being given to people to see if it works. And they are, we still are trying to figure out if those vaccines are safe and if they can be produced in enough quantities to reach essentially all of the world.
So, Dr. Delgado, what treatments are they currently using on patients that have extreme COVID-19 cases?
So the severe coronavirus cases are the ones that essentially land in the hospital that require significant amounts of oxygen for people to survive. And unfortunately, we don't have that many treatments. So far, we know that steroids can help some people. There has been an antiviral that was given what we call an emergency use authorization. The latest articles that are coming out are not very optimistic because they don't seem to have the benefit that we were hoping that they had. So we really are very limited on the treatments that we have for coronavirus at this point in time. That's why we are trying to look for other alternatives that could help us treat the virus in a more effective way.
Now, in a recent article, you stated that researchers are making progress by mimicking the immune system's operation, highlighting the elegant and sophisticated design of the immune system. Can you explain?
Sure. The way that the body attacks virus or controls viruses is this way. The body will produce something called antibodies, which are proteins, and these proteins will bind to the virus and essentially render it inactive. That is the way that the body essentially protects us against viruses. One of the principles behind using what we call convalescent plasma, which is another possible treatment modality, is essentially that we collect the antibodies from a person who has recovered from the coronavirus. We isolate the portion of the blood that has those antibodies, and then we transfuse it to patients that are infected with the virus, hoping that there are enough antibodies that will bind the virus and render it inactive. Unfortunately, we haven't seen a lot of good data also from this kind of approach. So one of the things that we are trying to do is to see if companies that have isolated those antibodies, which are called neutralizing antibodies, if we're able to find the right antibody and give it to a person that is sick, then those antibodies will bind to the virus and essentially render it inactive.
Can you offer up a better understanding of how bodies are designed to literally combat viruses using something called Sentinel cells?
Yes, the immune system, I gotta tell you, it is extremely complicated. And the way that essentially this happens is once you are exposed to, let's say, a virus, a bacteria, there are cells that will recognize that something is not supposed to be there. Those cells will essentially attack that pathogen. They will break it down into multiple small pieces. They will essentially sort out which pieces of that pathogen can be useful or can be the Achilles heel of that pathogen. And then they present those portions, those pieces of the pathogen to other cells and tell them, listen, this is what you're going to be looking for, so mount a response against this kind of a pathogen. Okay, it's this kind of structure if you see it around the body.
So Dr. Delgado, as much as we know about other viruses, what's the unique challenge when it comes to COVID-19 specifically? What sets it apart?
Yes, the challenge is, first of all, a time-wise challenge. The more we go through this pandemic, there is going to be a lot more deaths, number one. We will find some alternatives to combat this virus in the future, but this is really more of a time, a race against time. If you take, for example, another virus like the HIV virus, right now we have been able to produce a lot of medications that control the virus very well, but it has taken us more than 30 years to get to this point. Of course, the death toll from HIV is very high. So we're facing the same scenario with a virus that is actually killing people in a much faster way than HIV. So that's why the challenge is more a race against time at this point.
Now, when it comes to the virus, doctor, living on things like a piece of paper or maybe metal on a door handle on a car, or if you go to a clinic, how long does it actually live and how does it survive?
Yes, it depends on the surface that you're talking about. There are several studies that put out, there's anywhere between 1 and 8 hours, depends on what kind of a surface you are considering. Despite the fact that the virus lives for several hours on surfaces, it doesn't seem to be the main route of transmission. So you could be touching stuff that is contaminated, but unless you put that stuff directly in your nose, in your mouth, in your eyes, then really the chances for you getting infected are going to be rather low.
So, I mean, if we're social distancing or physically distancing 2 meters apart, about 6 feet, plus having the masks on, chances are we're not going to catch the COVID-19 virus.
That is correct. That is correct. Distancing and protection of eyes, mouth, and nose is very important to prevent transmission.
So, doctor, in your opinion, will the virus ever be completely eradicated, or will we have to learn with it, like you mentioned earlier, like with SARS or maybe with the flu?
You know, that's a very good question, and it is very difficult to tell at this point in time. The first SARS coronavirus 1, for unknown reasons, essentially disappeared from the face of the earth. So we have not been able to, to find that same virus right now. Will that happen with this coronavirus? You know, it doesn't sound plausible because it's already all over the place. A possibility is that this virus will be living in a small percentage of the population in areas of the world, throughout history. Really, we don't know yet, but that is a very interesting question. We don't have an answer yet.
As a medical doctor that has had so much experience working with viruses, what motivated you to conclude your article by saying that our bodies speak loudly about the exquisite design of our immune system and that we are fearfully and wonderfully made?
Monoclonal antibodies, what we're trying to use to fight this virus, is actually mimicking something that the body does, which is essentially manufacturing antibodies that are going to inactivate the virus. The interesting part is that our body takes only days to manufacture these antibodies, whereas it's taken us months to even get something that we can try on people safely. And this effort has involved multiple researchers throughout the world. So multiple minds essentially trying to mimic what the body does. It essentially speaks of a fascinating amount of design of the immune system.
As a Christian working in the field of infectious diseases, how has that really impacted your faith? And how are you able to harmonize your faith with science?
Yes. This is a question that has a lot of aspects to it. Part of the issue with infectious diseases, you could say, is part of the issue on why people get sick and what is the issue with suffering? How come they're suffering? So we could go on that side, but essentially my role, my calling has been to help those people that are suffering. I like the idea of infectious diseases, and the reason I became an infectious disease specialist is because it has a very tangible impact. We can really cure a lot of diseases with our antibiotics and essentially transform people's lives. At one point, infectious diseases was the main killer of humans, and with all the advances in modern medicine, we've been able to turn that around. Yes, there's still a lot of ground to cover, but we really have made a big impact on infectious diseases.
Dr. Delgado, let me ask you something. Some people are saying all of the wildfires we're experiencing up and down the U.S. West Coast, some of the flooding taking place and different viruses, including the novel coronavirus, are all signs of the end times. What are your thoughts?
I probably wouldn't go that far. I think that there are many of these things that we're seeing that have happened throughout time. And again, it would be very difficult to conclude that this is the end. This is the end of everything. I do not think that we would have the full picture to conclude that.
Dr. Francisco Delgado, thanks a lot for your efforts in the medical community, and thanks again for joining me on Bridge City News.
Thank you so much for the invitation again.
Raising a child with disabilities comes with challenges and victories. Throw in a global pandemic, and those challenges increase exponentially. Joining me now today is Dr. Edna Jacoto-SM. She's the Chair of Family Support for Children with Disabilities and a proud mom of 4 daughters, one of whom has Down syndrome and just turned 17. Dr. Edna Jacoto-SM, welcome back to BCN.
Thank you, Hal. I'm happy to be here.
Now, Edna, one of your daughters is actually home from high school because of a recent outbreak here in Lethbridge.
Yes, she is. We got the text and the email last night, and so we had to scramble to get in touch with 811 to try to book a test for her. And the school has been amazing. They phoned right away to find out if everything was okay, and they just gave us the details. And then they phoned again today just to make sure that everything was fine and how schooling is going to roll out. But we are not quite sure yet because they are ready to teach and everything is online for her, but we have to be with her when she's studying. But since she's supposed to be in isolation, we are not quite sure how that's going to look like right now. So we still have to work on the details about how to be able to support her. She has her EA ready to go, but it's our end that we are trying to work out the details.
Now let's discuss parenting a child who has a disability or is differently abled. Tell me about this journey, what it's been like for you and your family.
I think initially was a bit of a surprise because we didn't know that we're going to have her with the disability. But I think that, with time, you get to understand more about the condition. And then you learn to appreciate just the strengths that she has. But I'm not going to say that it's been an easy journey. It's a challenging journey. It stretches you as an adult. It stretches you as a human being. But I wouldn't trade it for anything.
Now, when you were told that your daughter had Down syndrome, what were your thoughts and feelings about it initially?
I think it was shock because we didn't know, and fears about how life was going to be like because I didn't know much about Down syndrome at the time. But then as time went on, we sort of knew that it was going to be okay. We knew it was going to be a lot of work, but we knew that it was going to be okay. Now, let me backtrack a bit. One of the reasons that we found out was that she had a heart condition when she was born because her physical features were not very consistent since she's dark skinned, because most whites who get it here, it's more visible. But because she's dark skinned, you needed to have experience to be able to identify it. So they weren't quite sure, but they suspected because of the heart condition. So once they did the genetic testing and we were clear, that we knew that, okay, we know what we are dealing with now. So it's been lots of up and downs, but I think that we are okay with it, and she's doing amazing well. So.
Now, Edna, you have 4 daughters. What is the family dynamic like? And more importantly, do you see any time in the bathroom?
I like that question. Well, family dynamics. Okay, so our oldest is 21, soon to be 22. And so she has been a really great big sister, and the 2 younger ones will tend to play together, and our daughter, she's the second one. So she's very independent. Let me just put it that way. She's super independent in the sense that she likes to do things by herself. But when she needs help, sometimes she doesn't want to ask, except when she sees a bug, like she sees an ant crawling, then she screams, "Help!" But other than that, yeah.
Now, the COVID-19 measures and restrictions have probably been a challenge for you on many different levels. Now, what have you done to ensure your daughter is safe and is understanding of the situation, your child who has Down syndrome?
Well, we've done several things. First of all, she needed to understand what was going on. Initially, she didn't quite understand why she couldn't go to school. So when schools were shut down, we told her she couldn't go to school. And I think she didn't quite understand. So she likes to get her stuff ready the day before school. So she sets out her clothes and gets her backpack ready. The night before school, she even gets out her lunch bag and packs her lunch. So when we told her she couldn't go to school, I think she was a bit confused. And then when we told her that we had to go pick up her stuff from school, she thought she was going back to school. So she decided to pack her lunch bag. And I said, well, yeah, it's not that kind. We are just going to pick up your stuff. So after we came home and they started online schooling, I think she understood that she couldn't go back to school for a while. And so we explained to her, the school explained to her, and we tried to take her out on walks because she couldn't have any programming. We usually hire someone to help us on a private basis, but that person couldn't come into the house because of COVID, and her programming through an agency was cut short too. So we had to get creative in trying to do things just to get her engaged. And that was a bit of a challenge because my husband and I were both working from home. So trying to work from home and then make sure we engage her was a bit of a challenge.
Now, when everything was shut down during the pandemic, were any family support programs available to you and your family?
Yes and no. No, in the sense that she used to go to a program in town every Friday, and that was shut down. They tried Zoom, but it wasn't the same. She just wasn't as engaged as she would have been. And then she was involved in Special Olympics, that was shut down. She couldn't do that too. So everything was taken away, just like everybody else. But I guess with her, it was more challenging because she doesn't talk very much. So we had to constantly try to probe to find out what's going on. And she shut down completely because she likes routine. She knows when she wakes up, she goes to school, comes home, and she has that routine. So she shut down initially. Throughout the summer, she actually didn't want to communicate much. But once the programs opened up a little bit in July, things got a bit better.
What have you heard about other families and how they've been impacted, other families who have disabled children, how they've been impacted by this virus and all of the COVID-19 measures?
I think that the impact comes in, well, depending on the nature of the disability. So if your child has very complex needs, it's obviously more difficult because then you have to get workers in. And so the government was very flexible in allowing parents to try as much as possible to customize their programs because there are regulations in place regarding whom you can hire to work in your home. Family members couldn't help you, but they were very flexible enough in agreeing to allow parents, upon request, to be able to make those changes so family members could help if people couldn't come into the home to help them.
Now, you are also the chair of the Lethbridge Christian School Parent Council. What support is there for children with disabilities right now?
Okay, so right now, I think that depending on their needs, if the kids are inside the school, they are able to support them. But I'm not quite clear on what is happening with kids who are not at school right now. Yeah, I still have to get clarification on that. But with kids who are in the school, they do have support.
Now, Edna, do you see any potential problems down the road or even right now when it comes to schools and how they've reopened, even during the pandemic?
I think that it's a very difficult situation and a complex one because, on one hand, I think schools are good for the mental health of our children because, I could see even firsthand that it really affected my girls because they couldn't socialize with their friends. So that affected them. But on the other hand, we know that when they are exposed to other students, there's a potential to have that outbreak. So from my perspective, I think it's a very, very difficult situation, but we cannot live in a society that doesn't have any risks. So provided they are able to manage it, I think I'm okay with it. Personally, I'm okay with them going. But of course, this wouldn't work for every family. There are some parents who would choose to homeschool their kids. And I'm so thankful that in our province, that option exists for parents. So whichever one you choose, they are able to support you.
Let's talk about your daughter who has Down syndrome again for just a moment here, Edna. What kind of independence does she have now that you can really enjoy in life?
Oh my goodness. She can do things by herself, like she can go to the bathroom by herself. She doesn't need anyone to help her to go to the bathroom. She When she's coming back from school, we drive her in the morning. When she's coming back, she comes home on the yellow bus. She gets off at her stop most of the time, and then she walks home. She's able to eat on her own. She can navigate the iPad technology more than I can. And those are skills that, like, I am so thankful for that she has those skills.
I mean, like most kids, she probably has hopes for her future. Has she talked to mom and dad about what she'd like to do when she grows up?
She doesn't say very much, so you have to prompt her. So next year she's going to turn 18, which is a big transition year, adult year for her. So we had so many plans in the spring to put in effect just to get her preparing for that stage. But unfortunately, because of COVID, all those plans were cut short. So we have to wait. And then just as things open up and we're ready to get things into motion, she's in isolation. So it's been up and down. Yeah.
Yeah, it's been a roller coaster ride, definitely. Edna, what advice would you offer parents who are struggling with raising a child with a disability?
I think, first of all, you have to see them as any other human being. I think you have to have that perspective that they don't have a deficit. That is just who they are. They have challenges in life. So you have to just accept them as human beings and treat them as human beings. Secondly, you have to see what they have to offer. They may not have certain cognitive skills, they may not have certain physical skills, but maybe a smile. Just look for the good in what they have, because I personally believe that everyone has something to offer and they have something. I mean, she has enriched my life so much. I don't know how my life would have been without her. I've gotten to know lots of people that have made such a big difference that I wouldn't have known but for her. So I would say that just look at the positive, and when you are having a bad day, ask for help. It is so important because the emotional and physical strains of raising a child who has so many challenges, it can be overwhelming, but it's important to know that there is help out there. So you can talk to your caseworker, talk to family members, get a support group around you. And a lot of the groups that, kids with special needs, they have different groups for different kinds of disabilities, if I should put it that way. So reach out to people and talk to people. It may look challenging, but you can overcome. And last of all, just take care of yourself. I think self-care is so important. Just get out, take a walk. It's not expensive. It doesn't cost money to get outside and enjoy the outdoors. So just get out there and enjoy the outdoors. Clear your head and talk to people. Yeah.
Amen to that. Edna, let's also talk about your faith and your relationship with God and how important that is, especially as you navigate through a pandemic and raising a child with a disability.
Oh my goodness. I think that has been the thing that has gotten me through all the challenges, because it's not easy. And so my faith actually has strengthened me in the sense that when I face challenges, I know that, I may not know what lies ahead, but I can lean on God and know that, He's always there, even when it seems like the sky is falling. He's always there to just see me through whatever challenges that I'm going through. And also, I have a very strong faith family that have been very, very supportive, and that has always helped. And also, I think that having a child with challenges drives you to ask questions. And if you don't look at the right place for the answers to those questions, your faith can be shaken. And that was what happened to me, because initially I was looking for answers. And then I realized that it's not a bad thing. I mean, having a child with needs is not a curse. You didn't do anything wrong. That is just who they are. And so when you have that understanding, by getting into the word and knowing the word, it really, really helps. So I'll just encourage people that, don't look at the wrong places for answers to your questions. Just make sure that if you're a person of faith, get into your word, because you will never know what you will find every day that will strengthen you. That has always kept me going, because I try to get into the word as much as I can on a daily basis. Sometimes it's just one verse, and we have YouVersion app, right? So you can just look at the verse of the day and just think about it during the day. And that really, really helps.
Amen. Well said. Dr. Edna Jakota Assem, Chair of the Family Support for Children with Disabilities, thanks for joining us today.
You're welcome. My pleasure.
On behalf of all of us here at Bridge City News, I'm Hal Roberts. God bless, and thanks so much for watching.